Definitions. Fibromyalgia, FM, a syndrome characterized by chronic, widespread musculoskeletal pain, fatigue, sleep disturbances, cognitive dysfunction, and other somatic symptoms. Diagnosed using criteria such as the ACR 2010, 2011, or 2016 revisions. Medical Student Syndrome, MSS, sometimes also called health anxiety or hypochondriasis among medical students. It refers to the phenomenon where students, learning about diseases, come to fear they have those diseases, worrying about symptoms, misinterpreting normal bodily sensations, etc. What research exists on FM among medical students? There are several recent studies that specifically examine how common fibromyalgia is in medical student populations and what factors are associated with it. Key findings: study, location, sample, prevalence of FM among med students, associated factors, findings. King Abdulaziz University, Saudi Arabia, 450 students, 18 to 26 years, various years except first year. 9.6% met FM criteria. PubMed, female sex, anxiety, depression, musculoskeletal pain, IBS, poor exercise, higher symptom severity among those with poor lifestyle. PMC, Poland-based cross-sectional, first and final year, 439 students, 10.48% FM prevalence. PubMed, strong correlations. Stress, poor sleep, low social support, behavior, career satisfaction. Lifestyle significantly influences FM severity. Egypt, Ain Shams University, 300 students, medical students, stratified sample, 14.7% FM. المجلة المصرية للطب العام, risk factors, female, poor physical activity, positive family history, sleep disturbances, chronic comorbidities. FM associated with reduced quality of life in physical, psychological, social domains. المجلة المصرية للطب العام, Egypt, medical students and interns, undergraduates plus interns, 13.3% FM, depression 38.4%. Ain Shams Medical Journal, students with FM had much more depression. Comorbidity of FM plus depression worsened functional status. Female gender, psychiatric comorbidity were predictors. Ain Shams Medical Journal, Jordan, University of Jordan, 332 responses. Medical students, 6% met FM criteria. Kajmi, female gender associated, many students with FM had not sought medical help. Lifestyle habits less clearly associated. What is known, hypothesized about MSS and overlap with FM? MSS is not very well operationalized in many studies, and there is less research directly linking MSS, the anxiety fear about disease, with full fibromyalgia syndrome. But some related observations. 1. High stress and anxiety among medical students. Many of the FM in med students' studies find that medical students' stress, sleep problems, anxiety, psychiatric comorbidities are strongly associated with increased prevalence and severity of FM symptoms. These are also the sorts of psychological features prominent in MSS. PubMed 2. Symptom awareness, somatic focus. Medical students are frequently exposed to detailed knowledge of many diseases, symptoms, and bodily dysfunctions. This exposure may increase scrutiny of bodily sensations or misinterpretation of normally benign sensations. That heightened symptom awareness is a component of MSS. If students are also experiencing fatigue, sleep disturbance, etc., they may interpret these as indicators of serious disease, or FM, even when they are more likely due to study stress, poor sleep, or lifestyle. There's less direct data proving causation here, but it's plausible. 2. Poor lifestyle factors. Several studies show that medical students with FM have poorer sleep, less exercise, more stressful schedules, less social support. These same factors often underlie or exacerbate both FM and health anxiety/MSS. PubMed 4. Depression, psychological comorbidity. Depression, anxiety, mood disorders are much more common in medical students with FM. These psychological factors might mediate the relationship between MSS, or high health anxiety, and symptoms of FM. For instance, in the Egyptian study, students with depression had much higher rates of FM. Comorbidity worsened functional impairment. Ain Shams Medical Journal 5. Underdiagnosis, low help seeking. Some studies note that many students meeting criteria for FM had not previously discussed their symptoms with clinicians. This suggests that symptoms might be ignored, dismissed, minimized by the students themselves or others, perhaps because they think they shouldn't have something as serious. This reticence is typical in MSS, students worrying but also perhaps fearing, looking foolish. Kajmi 6. Knowledge gaps and attitudes. Studies also report poor knowledge about fibromyalgia among solutions, as well as skepticism about whether FM is real or how serious it is. There's a hidden curriculum effect. Students observe attitudes of clinicians dismissing FM or regarding it as less legitimate. That influence whether students with symptoms take them seriously or seek help. Springer link, possible models, pathways. Linking MSS, FM, or overlap. Here are hypothetical mechanisms by which MSS and FM might be linked, or at least interact. Pathway, description, hypothesis, chronic stress, sensitization. Medical students often have repeated exposure to stress, academic, sleep deprivation, exams. Chronic stress can lead to dysfunction in neuroendocrine systems, HPA axis, autonomic dysfunction, altered pain modulation. This may predispose to or exacerbate FM. MSS contributes by increasing worry, hypervigilance, which themselves are stressors. Sleep disturbance and recovery deficit. Poor or inadequate sleep, common in med students, both increases stress and impairs mechanisms that modulate pain and repair tissues. Sleep problems are known to worsen FM symptoms. Psychological distress, health anxiety, worry, anxiety about health, as in MSS, may amplify perception of pain, fatigue, and somatic symptoms. In addition, depression and anxiety are cofactors for FM. So students with MSS features may be more likely to report or develop FM-like symptoms. Lifestyle behavior. Lack of exercise, poor diet, inadequate rest, irregular schedules, all common among med students, may contribute to FM risk. The added burden of anxiety and symptom watching may lead to reduced physical activity, more sedentary behavior, which may worsen musculoskeletal pain. Symptom amplification, somatization. Heightened attention to bodily sensations, a feature of MSS, may make minor aches be interpreted as serious, leading to more reporting and possibly even more physical tension, guarding, muscle tension, that worsens symptoms. Gaps, challenges, and what is not established. Causality versus correlation. Most studies are cross-sectional. They can show associations, e.g. stress, anxiety, sleep problems correlate with FM symptoms, but cannot definitively show that MSS causes FM or vice versa. It could be that early FM symptoms cause more health anxiety or vice versa. Operationalization of MSS. There is no standard measurement of medical student syndrome. Different studies use different tools, health anxiety inventories, hypochondria questionnaires, etc., and often MSS is not measured at all in FM studies. Distinguishing FM from transient symptoms. Some medical students may experience pain, fatigue, sleep disturbance that is transient or explained by lifestyle, e.g. long hours, poor posture, lack of rest, rather than full FM. It can be difficult to distinguish. Cultural population differences. Prevalence estimates vary a lot, from around 6% to 14% in different med student populations. Differences in diagnostic criteria, awareness, lifestyle, cultural expression of somatic symptoms, and stressors affect the data. Treatment intervention data scarce. Few studies have tested interventions specifically aimed at reducing FM symptoms in medical students, or exploring whether education about FM MSS reduces risk. Implications. For medical education, there is a need to include FM and other medically unexplained pain syndromes in the curriculum in a way that addresses both biological and psychosocial dimensions. Also to teach students about health anxiety and how to manage their own stress and symptom vigilance. Springer Link for student support services. Given a non-trivial proportion of medical students meet FM criteria or have FM-like symptoms, universities should provide resources, mental health support, sleep hygiene programs, counseling, perhaps screening. For clinical practice, physicians should be aware that young people, including med students, may experience FM and may underreport it or tolerate symptoms without help. Early detection, validation of symptoms, and holistic treatment, not only pharmacologic, may help. For research, longitudinal studies are needed to track med students over time to see who develops FM or FM symptoms, how MSS, health anxiety contribute, what lifestyle or institutional factors, curriculum, hours, support are risk or protective factors. Also, intervention trials, stress reduction, sleep improvement, lifestyle changes would be useful. Summary and hypothesis. Putting this together, one possible summary hypothesis is, open quote, medical students are a group at elevated risk for fibromyalgia because of repeated high stress, poor sleep, lifestyle challenges, and increased health anxiety hypervigilance, MSS. These factors may act both independently and synergistically to produce or exacerbate the physical and psychological symptom clusters characteristic of FM. Furthermore, heightened awareness of disease, a key part of MSS, may lead students to pay more attention to bodily sensations that others might ignore, thereby amplifying symptoms or perceiving them earlier, but also perhaps leading to overreporting or misattribution in some cases.